myself out of hospital, and even took up exercise, which is something that I hated doing, absolutely hated doing. But that in itself was a journey. I'd set a goal for myself. Number one, to stay out of hospital, and number two, ultimately to improve my quality of life. So I set out on a bit of a fitness journey, and it was a challenge trying to find a trainer to work with. And I was rejected by a few of them. It may have been because of my multiple health conditions, it could have been something completely different, I don't know. But the perseverance paid off, and I found somebody to work with. I must admit it was very difficult. It was challenging physically, emotionally and mentally it was challenging as well. Because of that feeling of breathlessness, I'd associate that with my lung collapsing a lot of the time. But I had to push through. And the thing that kept me going was the support that I had from my doctors. They were absolutely amazing. So I pushed through, and I got to a point where I started to feel a lot better. I felt so much better and started to look differently, and my eating habits had changed as well. About a year into training, my fitness trainer realised that I was doing much better than I was 12 months ago. And he wanted people to hear about my story. So he nominated me for an award, the National Fitness Awards, which is almost like the fitness industry's equivalent to the Oscars, you could say. And I was nominated in the Members' Achievement category, and that category celebrates the achievements of people that have transformed their health around. I was up against 5 people across the country, and I went on to win that award. And that was a huge turning point in my life. I stood there reflecting and realised, how have I got to this point? It's because I listened to my doctors. I became empowered and started taking better care of myself. I wanted to use this experience to help other people. So I went on to qualify as a fitness instructor in 2014, becoming England's first blind female fitness instructor. And looking back now, I truly believe that these empowering steps wouldn't have been possible if it hadn't have been for the empathy and the trust and the understanding from my doctors. One thing that has been quite difficult though is access to healthcare services. When I was diagnosed with my eye condition, not only was there a lack of sort of support in knowing which direction to go, but it's sort of dealing and adjusting to adapting to being visually impaired. Part of that was regaining independence. I have Laura with me today, and we've been together for 5.5 years. She's transformed my independence, not just my independence, but my health, because of the sort of additional sort of walkies and the exercise that you get from having a dog. I was actually petrified of dogs before I got Laura, so it was a bit of a challenge for me to actually decide a dog is for me. So it was a bit of a journey, a bit of a challenge, a process. But having seen how my other visually impaired friends coped and the independence and the freedom the dogs gave them, I felt like it was the right thing for me. I eventually overcame the challenge. It was a very gradual process, and it took 12 months before Laura came into my life. And things changed dramatically for me. The freedom she gave me, the independence, was incredible. And I found people's attitudes changed as well. Being out and about with the cane, there was a lot of ignorance. I have my cane on the table and a few assistive aids as well, people are welcome to have a look at. And it was mistaken for a walking stick a lot of the time. Because dogs, obviously guide dogs with the sash and the harness on, are identified as an assistive aid for the blind straight away. So I found people were forthcoming and helpful. I take Laura with me to appointments, and the staff are extremely helpful. I take her with me pretty much everywhere that I go. But I have encountered some accessibility issues. A law came into place in 2016 by NHS England called the Accessible Information Standard. And interesting enough, I wasn't aware of this law until recently. And that was created to ensure that health and social care information is accessible for people with disabilities or any kind of sensory impairment. There's more information on the NHS England website about this. And in the past, I have asked for my appointments to be sent electronically. My vision is very cloudy. It's almost like trying to look through a foggy window, so I can't see any detail. So I rely on assistive technology. So I have a screen reader on my computer, which enables me to navigate on the keyboard and reads everything back that's on the screen. So I did request for things to be sent electronically because it's my preferred means of accessing information, and that was refused. And thinking about it now, it's maybe because people they are not aware of this new legislation, and I imagine some patients are, because I wasn't. So if you ever encounter a patient who has a disability or a sensory impairment, looking back now, what I feel would be helpful is actually to let them know and to have some understanding and awareness of it yourself as well. Only because it just makes things so much easier. I remember an incident when I had an appointment at the hospital. I went in and checked in at the desk and expected some assistance to my chair. And the appointment was actually at an eye clinic. The member of staff who were asked to help me had no idea how to guide me at all. I had to tell her how to guide me. And I was manhandled to the chair. And it wasn't very dignifying at all. I was eventually called in to have my eyesight tested, and again I had to stand up and shout for help. I was holding the cane at this time, and I was very surprised to find that even then that nobody sort of approached to help me. I eventually went into the consultation room, and it was a tiny little room, obstacles everywhere. It was dangerous, it really was. And being visually impaired, your spatial awareness isn't that great. So you do need a little more assistance. You're aware of what's around, but having that lack of vision makes things a little bit more dangerous. So I would say that things like this could have been preventable if there was more staff training, for example, if there was more education around sight awareness, how to guide people who are visually impaired, particularly when you're attending an appointment, an eye clinic appointment, for example. So staff training, understanding what the accessibility needs of your patient actually is. What is their preferred format? Imagine the consequence of a patient receiving an appointment letter through the post, missing that appointment, and just not being aware of it. It could potentially be damaging to their health, and it's happened to me a few times. I have to rely on my family to read the letter sometimes. So that's something really, really to think about. I'd also like to mention about going back to the health challenges again. I'd say that having spoken to other patients, accessibility around accessing group fitness, for example, for people with lung problems, for people with visual impairments is a difficulty as well. And we all know that exercise and living a healthy lifestyle is beneficial for us. But what I didn't realise was the impact it would actually make to my quality of life. The difference between not doing that and living a better lifestyle now has been dramatic. There's been a change in my health and well-being. Not only am I stronger and fitter, but my blood pressure's come down. I've had no hospital admissions since 2014, and just feeling much better in myself. And my appointments, the frequency of my appointments have gone down also. I rarely see my doctors or my GP now. I've learned how to manage my own condition. So if you ever see a patient who you feel would benefit from living a healthier lifestyle, what could you do to empower them to listen? Because sometimes it's difficult being told, because I know I was one of those who didn't listen at all. helping them to understand the long-term benefits, perhaps using other patients as examples, referring them to organisations that could perhaps help them and empower them, and support groups. And a lot of the time it's about making small, tiny changes. I know I can't speak for all patients, but I know for me, during a period of time, my condition became my identity. I let my lung condition control me, and it dictated my life, pretty much. Once I regained control of that, things started to change and transform for me. And it's easy to fall into that hole sometimes, but as doctors, offering that support, that empathy, encouragement can make a difference. If a patient feels like they're actually being listened to, they're more likely to listen. Patient care is so priceless. It really is. And having seen it from both sides, as a perfectly healthy teenager and then suddenly becoming a patient using the healthcare system, I've seen what has worked for me and what actually hasn't worked for me. And I hope that you've been able to take away a few insights today that will help you when you're working with your patients, so that you're able to empower them to be able to listen and help them to think differently about their condition and manage it much better. Thank you. Okay.